Hi everyone, my name is Dr. Ryan Rebo at the Park Clinic for Cosmetic Surgery, and I wanted to talk a little bit today about one of our most common consults, which is the mommy makeover. So this is something that has kind of come into common lingo. People talk about it a lot on social media and amongst themselves, and so I want to talk a little bit about what it entails and some common questions we get during consultation. So when you think about a mommy makeover, you think about some combination of either or together breast surgery and abdominal contouring. So commonly you talk about either a breast augmentation or breast lift, or both of those together combined with a tummy tuck procedure. So we'll start with talking about the breasts and what that entails. So the most common thing I see is most women kind of feel deflated after having kids, and so they come in for a consultation on breast augmentation or wanting breast implants. And for some women, this is a really good option. What I would normally tell people is that the main thing that you're seeing is a lack of what we call upper pole fullness, or the upper part of the breast loses volume. And the only way to really replace that is with an implant, because even with a breast lift, this only really reshapes the bottom part of the breast and doesn't really give you that upper pole fullness that most women are looking for. So I think that most women are correct in assuming that you need some sort of breast augmentation, but oftentimes this does need to be paired with the breast lift at the same time in order to give you that good shape that you want, because just doing a breast augmentation is not really going to lift the breast back up to where it needs to be. It's going to create an awkwardly shaped breast, and this can either be done at the same time or it can be done in a delayed fashion. In other words, doing a breast lift with an implant later. That way we know that we get the shape correct. I think that's a really good option for a lot of people. The other thing that we commonly talk about with mommy makeover is a tummy tuck procedure, and this can be done a lot of different ways, but the most standard way of doing a tummy tuck is with a large incision sort of at the lower part of the abdomen that we try to hide in the underwear or bikini line, along with an incision around the belly button. And this is often paired with some sort of liposuction type of contouring. This is, again, an excellent way to get the shape that you want after having kids and getting that skin all stretched out. And kind of, again, a common thing that we get asked is, why can't I just have liposuction with this? And the real answer is that because that skin is so stretched out after having kids, just liposuction alone is not going to give you the contour that you really want for the majority of women. So you really need to do some sort of excisional procedure that we will combine with liposuction in order to get you the contour that you want along the outside of the abdomen, or what we call the flanks. Now again, there's lots of different types of tummy tucks. Sometimes you need what's even called a fleur-de-lis tummy tuck, where you take the scar up the abdomen a little bit and you have a little bit of a vertical scar. But for most women getting a mommy makeover, that's not the case. Most women will just need a standard abdominoplasty or tummy tuck. The other thing that we do in a tummy tuck is actually tighten the muscles, and so your two six-pack muscles that run up either side of your abdomen will also get stretched out with pregnancy, and that can give you a bad contour of your abdomen and can really contribute a lot to poor contour of the abdomen. So we actually sew those muscles back together to give you the contour that you want, along with the skin excision. And again, we could do kind of any combination of that for a mommy makeover procedure, so you can get any combination of breast surgery with most combinations of tummy tucks at the same time, if you really want to save time and downtime associated with either procedure. Benefit of doing this at the Park Clinic is that both Dr. Park and I are here, and we will often operate together at no additional cost to the patient, just to make sure that, one, the time that you're under anesthesia is lowered, which lowers morbidity and complications, and also lowers costs, and two, to lower surgeon fatigue, and also to get, obviously, two sets of eyes on the operation, make sure that we're both doing a great job. So both Dr. Park and I do perform all those procedures independently or together. So if you're interested in any of these procedures, just give either here or a call. We'd be happy to see you.